Hello everyone, welcome back to the Beauty Matters with me, Lin Hussin, on ALB UK TV. Today we are joined by one of London's leading aesthetic practitioners. He practices in a wide range of cosmetic procedures and specializes in non-surgical ones, producing amazing results. Dr. Wong. Hello, doctor.
Hello, thank you so much for having me.
Thank you for being with us. I introduced you as an aesthetic practitioner.
Yes.
Can you tell me a little bit more about your background?
Okay, so I'm a fully qualified doctor. So I did my medical degree in Scotland, 6 very long, cold years, and then I started working in the NHS. So my last job in a hospital was actually in plastic surgery, and it was at that point when I started to branch out into aesthetics medicine, and now I do aesthetics full-time.
Now we'll take you away from aesthetic practitioner for a bit and talk about beauty pageants.
Yes.
I know you've been involved in beauty pageants, which is Miss Universe Great Britain. Is
Yes,
that right?
that's right. So I'm one of the judges for Miss Universe Great Britain. I've been doing it for about 3 years now. Yeah, so it all started when I met one of the contestants before I joined, Amy Willerton. So she broke the record by being one of the first contestant in 30 years to place top 20 in the 35 years of Miss Universe history.
Yeah.
So then since then, because of her success, then I started becoming a judge on the panel. And then since then, every girl that has won has been placed very, very highly, which is something I'm very proud of.
Yeah, it must have done really well. What are you looking for in your contestants?
I think we are looking for the girl with the confidence who can, own the stage and have that presence that's going to wow everyone. Obviously, beauty is an aspect of it, but then there's also the confidence and personality that comes along with it as well.
So you're looking for the confidence in a lady.
Exactly, yeah.
And what beauty means to you in general then? Because you said it's part of it, beauty.
Yeah. So for me personally, beauty and aesthetics means matching how you look on the outside to how you feel on the inside. So that would be my definition.
So people who goes to do like cosmetic procedures, do you think they got addicted to it, or is there like a limit where they think like I had enough?
I think this is a very important thing, and I always tell my clients that aesthetics or any work they're thinking of having done should come from a place of love. So you're doing it for yourself, to improve yourself, to make yourself better, and not because someone else tell you that you look tired, or because someone tell you look old, or because you hate a particular part of your body or your face. So it should always come from a place of self-love.
And do you think people get addicted to it? Like, I personally know some ladies who they looked amazing before they start this journey of getting like things done one after the other. And when they look back to their photos, they miss their old look. But I can see that they are addicted to it in a way.
It is a very slippery slope. So people do get addicted very, very easily because obviously with fillers and things like that, you can see the results instantly. And, it's almost like once you have the taste of what you can achieve, that it can become quite an addiction.
You want more and more.
Exactly, but I think it's down to the doctor or the practitioner to actually help guide the client so that, they are not overdoing it.
Do you tell your client, no, I'm not doing
that?
A
lot of times, yes. But the thing is, they'll always go like, a few doors down the street and then find someone else who will do it. Exactly.
But at least you did your best by giving the right advice.
Absolutely, yes.
So what's the recent cosmetic procedures, non-surgical ones?
So there's so many things that we can do now. So I think as a whole, the aesthetics industry have expanded on what we have traditionally, so Botox and fillers, but we have more indications now. So for example, we can now do a rhinoplasty with dermal fillers. We could correct earlobes with dermal fillers, which has never been done before. We could also use Botox in certain areas, like for bladder, for muscle problems.
More medical use.
Exactly, and also aesthetics in different ways. So say, for example, if you're a lady who works out in the gym a lot, sometimes you can get quite defined muscles on your shoulder, which can look quite manly.
Yeah.
So we can now use Botox to actually reduce that and make you keep that feminine figure. So, yeah.
Yeah, there are things when I checked the website, you do a lot of things,
A
but
lot,
one
yeah.
of them is, I personally found it interesting, like a nose job non-surgical one.
Yeah.
Do you achieve the results of the surgical job? Is it like you get that difference?
Yeah.
Or?
It depends on what you're hoping to achieve. So everyone is slightly different. So if you're looking to have a thinner nose, we can actually create an illusion where we put a little bit of filler in the midline
Yeah.
to give you a pinched look. So even though we're adding volume, we're actually making it look thinner.
Okay.
Yeah, but then obviously there's certain things that only can be achieved with a surgical procedure. So there's still room for that, but then a lot of things these days can be done without going through surgery.
And you are based in Harley Street.
Yes, that's
When
right.
you have another clinic.
Yeah, I'm in Kensington.
Yeah.
Yes.
And do you have any like special treatment, cosmetic procedure for your clinic?
Yes, so the latest thing that I have, this
That's
exclusive,
what I was waiting for.
the exclusive thing that I have in my clinic now is something called Tesla Former. So this is a device that helps you to tone your body muscles without you working out. So you can achieve 6-pack within 8 sessions. You can have it every other day if you
Wow.
really want to. So within 2 weeks, you can walk around with a 6-pack. Basically, it does 50,000 crunches in 30 minutes.
So that's the theory behind it, how
Exactly.
yeah, how
So
it
it
works.
uses electromagnetic field to create a strong muscle contraction. So imagine if you're holding a crunch position and doing it 50,000 times. That's the results that you're going to get.
Wow.
Yeah, and I also treat a lot of celebrities and things like that. And Simon Cowell is one of the fans of Tesla Former.
And you do also fat dissolving, so
Yes.
you can dissolve the fat first and then create.
Yeah, it's different for everyone. So we
Yeah.
can dissolve the fat with a few different types of injections. So
How long does it take for these injections to
the
work?
injections itself generally take about 5 minutes, but then for it to work, it can take up to 6 weeks. Yeah.
Is there any side effects for them?
A bit of swelling, bruising depending on the area. So if you're treating the tummy area, it can bruise quite a bit and it can last for a bit longer than your normal bruise, so maybe about 2 to 3 weeks even. Sometimes it can be a little bit tender, but those are all very transient and they go away on their own without any intervention.
When we talk about Botox and filler, which now became the traditional
Yes.
cosmetic procedures, what age ladies can start to do these cosmetic procedures on them?
I mean, legally speaking, it's 18 and above, but I generally tend to treat people from mid-20s and above. I don't treat anyone who's too young because obviously your face is still changing. And I also think social media plays a very big part in that because everyone's taking selfie, they want to look like a celebrity, Kylie Jenner, for example, and things like that. And I don't think that is very healthy for a young person's mind. So I tend to not treat them unless, okay, so the youngest person I've treated for Botox is actually 18, but it was a stage where she was going to college and she has this very deep frown line on her forehead. So obviously it's that age where you want to fall in love, you want to look good and things.
Yeah.
So that is one exception. So there are cases like that, but generally speaking, I don't treat anyone below 25.
You talked about social media. It's a very interesting topic because people, especially young ladies, put pressure on themselves by trying to look perfect. Is there what perfection you think means to them?
I don't think there's such a thing as perfection because I think everyone has their own imperfections and that's what makes them beautiful. Actually, there has been a facial study where they look at asymmetry within faces. So obviously everyone's face is slightly asymmetrical. We always have one side is stronger, with stronger muscles, one side with more lines and things like that.
Yeah.
And they tried to create this study where they took half of the face and then duplicated it so that the face is perfectly symmetrical. And actually they look less attractive. So I think that's a very important, powerful message to say that, a little bit of imperfections here and there is actually what makes you perfect and attractive.
Yeah. The other thing is a study I saw for taking like a best part of every celebrity, for example, a best nose, a best eyes, and put them together. It will be like a regular person. You wouldn't look at them and say like, wow, so pretty.
Exactly, yes. And I think it's also one of those things, if you have, say for example, the most beautiful nose, you want that feature to stand out. So if you also have the most beautiful lips, the most beautiful eyes, then it distracts from the fact that you have an amazing nose.
Yeah. Yes, that's very true, and it's a powerful message for ladies who, especially young ladies on social media, who are trying to put the pressure on themselves.
Yeah.
Now I want to talk about you as a teacher.
Okay.
I hear that you teach as well. Can you
Yes.
tell me a little bit more about it?
So one of my passion in aesthetics is actually teaching, and I believe that because obviously within the UK, aesthetics industry is not very well regulated, and I think as a cosmetic doctor, it is my responsibility to actually deliver the best training possible. So I train for Botox fillers, jet plasma, and PRP, IV drips. So a lot of the procedures that I do myself, I train other people how to do it and things like that. And I think there's always room for improvement in that sense. So for a lot of the procedures like the injectables, Botox and fillers, I work with Elegant in the UK. And then for the plasma pen, I use Jet Plasma, which is a very well-known safe brand that is the only direct current pen on the market. So the brands I work with, I tend to choose very, very carefully, and also the qualifications of students. So if you're looking to do things like Botox and fillers, you have to be a medic, whereas certain other procedures like mesotherapy, you can be a high-level beautician or phlebotomist.
Like non-medic.
Yeah.
Do you think that, I think that's a bit risky because
Very, yes.
Because it's for someone who doesn't have the medical background, it can be or know enough anatomy. They can inject it in a blood vessel. So even in social media, we see lots of mistakes happens, and it turns as a disaster.
Absolutely. I think at the moment the industry is very split between, obviously, non-medics are allowed to do it. They're not breaking the law or anything like that, but then obviously they also lack the knowledge, the anatomy, as you say, and also how to deal with complications, because things can actually go wrong. Yeah. So I think at the moment there's a huge split between the medics and non-medics, which in a way is good, but then at the same time I think medics have to be a little bit more supportive towards the non-medics, just in case they have, because at the end of the day, our duty is to the general public. So if they have someone that they've done something and it's wrong, they need to have that confidence that they can actually safely refer that patient to a medic who can help out. And I think non-medics are very good at doing certain things like skin peels, microneedling, things that are more superficial and a lot safer. And I think that should be the way it is. I mean, you know, I wouldn't personally go and do a heart transplant, for example, even though I have all the anatomy knowledge. I just wouldn't do it because I'm not trained to do it. Yeah.
So always check. We wouldn't say qualification, but check on the person if he's expert enough to do it.
Absolutely.
Have the medical background, because it's like it's a one face. You can't replace.
Exactly. And you wouldn't let anyone on the street cut your hair, would you?
So, so how you make someone inject your face? Yes, very interesting point. We'll talk now about laser. Now, laser is now it's involved in cosmetic procedures. So what type of procedures do you do using lasers?
So at the moment, I'm using an erbium laser. So it can do things like stretch marks. It can treat pigmentation, acne scarring, snoring even. So the list is endless now. Yeah, so if anyone complaining about the snoring partner, the person to go to. And in terms of laser, is it like we can fix places on the body in terms of like fat reduction as well, or is it injections more, or what do you reckon? Yeah, I think it's different people have different needs. So if your general target area is quite small, then injectables will work very well. If it's a bigger area, then something like HIFU, which is high intensity focused ultrasound, will be more beneficial than the injectables as well. But then beauty and aesthetics is so subjective, so it depends on what you want to achieve, how quickly you want the results, and things like that.
I had a question from one of my followers said when they knew that I have a cosmetic doctor coming to the clinic. to the show. They said about, is it okay to do like a cheek filler and draw like lines at the same time, or how to choose? It's really tricky questions because it depends on the person, right?
It is, and that is something that I actually specialize in called facial balancing and harmony. So it's basically looking at someone's face and not actually saying, you know how traditionally patients be like, oh, I want to get rid of this line, I want bigger lips and nothing else, I want bigger cheeks and nothing else.
Yeah.
Whereas this facial balancing harmony is a kind of new approach to it. So look at someone's face and then think how you can make them look more attractive. So there's certain rules that we have to follow, certain harmony that has to be respected. So then, and it's different for a male face and a female face. So what we do is we actually look at the proportions and things like that, try to balance out the face. So we could be doing a little bit in the nose, a little bit in the lips, a little bit in the cheek, all at the same time. So yeah.
But now it's the trendy word is like the jawline.
Yes.
So what do you think of it?
I think it is the results that people are getting, especially with Volux from Juvederm, it's phenomenal. Like you can achieve so much with it. But as with everything that is trendy, for example, you know, the lips, it was trendy once upon a time, and then it just became so big and so big. And now
out of control.
Exactly. And now the same thing is happening with jawlines. You have very pretty young girls with very defined and straight jawlines, which actually makes them look more like a man.
Yeah.
So,
yeah. How they will find the limit in your opinion? Like when they will start to cross the border of too much and okay.
I think the main responsibility lies within the doctor and the practitioner to tell the patient, you know, this is enough, this will suit you, anything more is just going to look a bit silly.
Yeah.
And also down to the patient, because obviously when even I do it myself, when I look in the mirror, I know where my imperfections are, and then they look so much bigger than anyone else. So someone might be like, oh, we don't even see it, but it's like, oh my God, I have this huge spot. It's like, yeah. So we know where insecurities are. So which is why I think, as what I said at the start, it's important for people to approach aesthetics from a place of self-love rather than, I hate this part and I want to improve it. It's like, I like my face, but I want to improve it a little bit better. It's a very different approach, very different mentality.
So, Dr. Wong, what are the risks of non-surgical cosmetic procedures?
So, in the hands of someone who's medically trained, the risks are very minimal. So it would be anything to do with needle insertion. So things like swelling, a little bit of bleeding, bruising are the main ones. However, certain treatments, for example, with dermal fillers, if it's injected in the wrong place, it can actually block a blood vessel, what we call necrosis, which is tissue death.
Yeah.
So depending on where you're injecting, for example, if you're injecting the temple region, then you can actually cause permanent blindness.
Wow, so it can be very risky.
Exactly, and some of the risks cannot be reversed.
Yeah.
For example, blindness, or if you have reached a late state of necrosis where the tissues are already dead, then you have to excise that surgically, and then you're left with a permanent scar.
Did you have any case when someone come to you to fix like someone else's mistake?
Yes, a lot. Actually, last night I treated someone who had fillers done in the lips, but then somehow migrated to another area, so outside the lip. So it looks like she had lumps around the lip, which sometimes can happen depending on the type of product that you use, the experience of injector, so on and so forth. And it is quite common, and so that is an example of something that is quite minor that can be corrected by just dissolving the filler, because hyaluronic acid can be dissolved, so it's fully reversible that way.
Yeah.
I've also had cases where I personally have had to refer to a surgeon because what happened was this patient was injected by a colleague, and again, it was lips, but then she started having a rash around the cheek and the forehead the next day.
Yeah.
So my colleague didn't think much of it and just didn't think it would be related at all. And then when I saw the photo, my heart sank.
So what was it?
So because what happened was there was an occlusion to the vessel. So because it's the same vessel that goes up all the way to your face and to the forehead. So the pattern of the rash is actually tissue lacking oxygen that's tracking and following the path of the vessel. So then I was like, okay, this patient needs to come immediately.
Yeah.
We need to dissolve it, put on antibiotics, vasodilators, everything, and then send it to a surgeon for review just to see the stage of necrosis that has happened, whether it's reversible or not. Thankfully, it was all fully reversible, and we managed to save that face.
Oh wow! So people, please be careful. Don't go to anyone. Do your proper research before you. It's your face. It's not only about how you will look. It's health related at the end of the day.
Absolutely, yes.
You talked about we are able to dissolve fillers now. I saw in like some celebrities who after a while think now filler is not a trend anymore, I want to dissolve it.
Yep.
What do you think of that?
I think if you are going to have fillers, it's best to let it dissolve on its own.
How long does it take?
Depending on the type of fillers, it can take up to 18 months, the longest, for hyaluronic acid. Certain more permanent fillers can take a bit longer, but it's just because if you're dissolving the filler, you are actually injecting a substance that's animal derived, so there's a 6% chance of an actual anaphylactic reaction.
Like what?
So a strong allergic reaction. So
allergic reaction.
Yeah, they can go into anaphylactic shock as well, where they can't breathe and things like that, which is a major case.
Yeah.
And also with the inflammation, swelling and everything, it's not going to do any benefit to your skin or to your face.
Yeah.
So if you are thinking of having fillers, it's best, if it's not a complication, or if you're happy with the way it looked after it's been done, then my advice is to actually let it wear off on its own. If, for example, you have to dissolve it for a medical reason or whatever, then that's a different story. But once you make that decision, I would say stick with it, would be the safest option.
Yeah, so stick with it, and it wouldn't last forever.
Yeah.
So it's limited between like 18 months or depending on the material used. So do you work with certain companies to provide your materials?
Yeah, so for Botox and fillers, I use the products from Allergan. And then for the body toning, I use Testaformer. For the plasma pen, I use Jet Plasma. And for actual PRP and IV vitamins, I've actually started my own company, so I'm using my own products.
Oh wow! Okay, we need to know about that. Your own products are in market now.
Yes, they are. Yeah.
Okay.
So the company is called Vindoc Lab. So we do 2 products at the moment. So one is PRP, and the other one is the IV vitamin drips.
And if someone wants to order it, do you provide it for like online order, or it need to be a medical related?
Medical,
related.
Yeah, exactly. And also we have to do training for the person before they can order from us.
Okay.
Just from a safety point of view.
Yeah. So you are really focused on the safety.
Absolutely.
Before,
yes.
yeah. So safety before cosmetic and beauty.
Exactly, 100%.
And now we are going to be joined by Jamie. He's a model with us in the studio. Dr. Wong is going to show us before footage of what he's going to do in terms of cosmetic procedures on Jamie. Thank you for being with us. So Dr. Wong, what is a medical procedure you are going to do with Jamie?
Okay, so Jamie is actually quite an interesting case because obviously a lot of people think of cosmetic procedures and think about women.
Yeah.
So obviously, this is not the case anymore. A lot of men are coming forward for procedures, and Jamie is actually quite young. He's only 28. So we're not going to change his face dramatically.
Yeah.
But we're just going to enhance certain features to make his face look a bit more masculine. So Jamie only had one thing that he wanted to correct, and that's the nose to mouth lines that he has.
Yeah.
So this is quite a common thing for both men and women. So we can correct that very easily with fillers.
Yeah.
And then we're also going to strengthen the cheekbones to make it more masculine. So this is where it differs majorly from a female face because the fat pad distribution is different, and that has to be respected as well. And then we're also going to enhance the jawline to give him a squarer jaw so that overall he will look a lot more masculine.
So 3 different non-surgical procedures you are going to do, and we will see the results afterward.
Yes.
When you have, you said like men are more involved now. Now, is it? Have you noticed it recently that men wanted to do more enhanced?
Yeah, over the last, I would say about 5 years, it's slowly increasing. Yes, definitely. And people are looking after their skin a bit better as well. So it's just skin quality, laser, microdermabrasion, skin peels, that kind of thing. Yeah.
Yeah, beauty is for everyone.
Absolutely.
Thank you so much, Dr. Wong, for being with us, and thank you, Jamie. And it was a pleasure having you both in the studio. We are looking forward to see the results. Stay tuned to see how Dr. Wong is going to change Jamie's face. Stay tuned with us on Beauty Matters.